Thank Sir AMC for calling me over here. When Dr. Mani called me, the first thing I told him it won't be feasible because of a lot of unscheduled meetings come up because of the corona these days, and I'm not sure whether I will be able to have free time at that time or not. And thanks for that introduction. When they asked me, give your biodata, I said only one liner is enough. There's no need to have pages after pages. Now, if you look at this corona epidemic, we started last year. We faced many challenges, many problems had to be sorted out. Right from the disease course, the treatment protocol, nothing was sure. Everybody was using whatever they feel is the good. And then CFR went on rising, it went right up to 7%, at places 11%. And then we started getting drugs for the same, and the thing came down. To start with, the anxiety which everyone had, many of our medical fraternity also tried to shrug the responsibility. And under the pretext of comorbidity, the refusal of work was also a little problematic. And I was looking after the reasons why a person refused the work in COVID. One particular physician had written, he has comorbidity, and comorbidity was hemangioma in the liver. So can you understand the thing that people used to start with because of the fear, basically. Many hospitals saw running away of class 4s, running away of staff nurses. But thereafter, everybody realized that we have to fight it out. All of them came back, and we started fighting back the disease and the epidemic. And then the cases started coming down. But the thing which was still worrying is high CFR. Okay, case fatality rate is still high, and why it is high even after we know about the disease so long was a dilemma. Okay, so I think we have, now the time is there, we should have a real new protocol. And according to me, what I have seen these patients, in mild and severe, don't use any antiviral. Antiviral has place only in moderate group. In mild, they don't need it. In severe, they make patient worst. So I think we should look out for that and start using a new protocol where moderate cases, and we'll try to catch the patient when the patient is on moderate stage and hit hard at that particular time. Because now we have seen, after giving remdesivir in severe cases, instead of improvement, there was some deterioration also. So the new protocol will be out within, I think, next 2 to 3 days. The Bombay group has prepared it. Let us see what they will come out with, and then we'll try to correct it for our local needs and local things like. Since yesterday, मला साधारणतः एक 10 ते 12 रिपोर्टरचे फोन येऊन गेलेले आहेत. प्रत्येकाचा प्रश्न एकच आहे की सेकंड वेव्ह आली का? Okay, so basically, if you look at any epidemic, I was just talking to them, you have an epidemic peak followed by one bump, second bump, third bump, and then epidemic disappears. So right now what we are seeing, because of the relaxation of all these the conditions, this we put it as a bump. But whether this will turn into wave or not, it depends upon us. If we continue to roam around and don't have COVID-related restrictions and the behavioral pattern, definitely this bump can turn into second wave. So it's the duty of all of us as a medical fraternity to explain this to all our patients, their relatives, their society, public at large, that yes, there is a rise, but if we take care, this will remain as a bump and not as a wave. Okay, and that's important job which we need to do at all cost. Second question everybody is having in the mind is about the mutation. Because this mutated virus, what havoc it will create. Now, virus by its initial characteristic will mutate. Any virus will mutate. And the mutation will be in India also, in Brazil also, in England also. Now, whatever is coming out in the paper, England variant, Brazil variant, South African variant, is nothing. Basically, the virus has characteristic to mutate. It will mutate in India, and the way they showed it, the Yavatmal mutation. whatever Yavatma mutation was shown, the clinical picture is it is far more infectious, but very less hazardous. Hardly anybody goes into ICU. Okay, if you have that mutation, the case fatality rate will come down. But if you have mutation like what it has in England, it has started affecting the younger age group from 15 to 45 most, followed by 10 to 15. And third one was more than 60, which was exactly opposite the first virus. Okay, so whichever way it mutates, it will change clinical course, and accordingly we have to change our strategy. So we shouldn't be afraid about the mutation at all. We shouldn't be afraid about mutation at all. Let us check what characteristic the thing has done. Now, for example, this virus attaches to the ACE receptor, and ACE receptor are immature in pediatric age group. Hence, pediatric patients were not been seen in the first peak. Because of the mutation, instead of having a peak, there was no peak to start with for this virus. Now it has 1 peak, 2 peak, and 3 peak type of mutations. And these mutations make virus fit to attach immature ACE receptor. Obviously, if it attaches immature ACE receptor, it is going to infect the pediatric age group and adolescent more than the older one. Because most of the older ones are already being affected and have some degree of immunity. Okay, so whichever mutation comes, we just have to follow it, how is the clinical course, and act accordingly. So that was the second thing which I wanted to mention over here. And don't be afraid of any of these mutations, and there should not be any panic wave. Third question is regarding vaccine. Most of it has already been dealt with by Mr. Sudhir Mehta. So obviously, the only way to prevent second wave is to vaccinate everybody. But there is a laxity in medical community itself for getting vaccine. We have registered 2,105 persons from our medical college for vaccination. It's almost 10 days, only 1,153 have taken it. That means barely 50%. Rest have not taken it. How many of you have not taken vaccine in this hall? Everybody is vaccinated, or there is somebody who hasn't taken? So basically, as a medical fraternity, we should come forward and vaccinate ourselves. And give the example that yes, I am getting vaccinated, so everyone else should also take the vaccine. Especially fear in the mind of nurses, the class 4s, and sometimes this TV news. परवा दिवशी तुम्ही ते टीव्ही न्यूज पाहिली असेल, आय थिंक लोकमतवर होती का कुठल्या तरी चॅनलवर होती. वॅक्सिन घेतल्यानंतर 9 डॉक्टरांना 7 दिवसात करोना झाला. So all of you must have listened this news. Such news is detrimental to vaccination program. See, basically all of us must realize this is the first dose which give 42% immunity. Second dose after 28 days. 14 days after that, you will get 87% immunity. So when you take first dose, to get immunity, you take 42 days. In these 42 days, you are likely to get corona. But just because if you have taken vaccine, you start using masks, you start avoiding having physical distance and all that, you are bound to get corona. There's a simple science behind it. So such news obviously produce the obstacle for the vaccination. So we as a community, medical community, we should try and educate the paramedical staff and try to tell them that what is the basic notion, complications of corona are far more dangerous than complications of vaccine. If this message goes, many of our paramedics in class 4s will come forward for vaccination. Okay, after vaccination, yes, there will be some side effects. But what we have seen, I think that might be your experience also. If you give vaccine at 10 a.m., between 11 p.m. to 1 a.m., you are bound to get fever, rigors, body. And this occurs in 70% of the patient. So what advice we should give whenever we give vaccine, ask that person to take Dolo 650 or paracetamol 650 tablet at 8 p.m. So that fever and spike will be avoided, and then they will say that yes, vaccine is good, no problem with everyone. Okay, such simple things will help the vaccination drive more and more. And what Sudhir Mehta sir said regarding mass vaccination, I think they should take up that as an agenda, and we should show as Pune as a role model. So all country always talked about Bombay spirit. So this time the time is that we should show our Pune spirit also, and we can take care of our Puneites better than any other city per se. And we all the private hospitals, including our college also, is thankful to PPCR. They not only gave PPE kit, the mask, the ventilator, pulse oximeters, as well as HFMO. So the donations which you got, and almost every hospital in Pune got from the PPCR, and such type of activities, I think, should not be limited only for the pandemic situation. And if we have year-long going activities with the industrial partners, we will be in a position to have better health care for our Pune people. I think those were the things I would like to mention. And with that note, I think I will stop over here. And if anyone has any queries about Corona, I will always be open to clear them. Thank you.